This video will demonstrate the use of Zato Health software for analysis across decentralized health data sources. This example deployment was funded by Zato Health and IBM Corporation. Quantum improvements in patient health outcomes and cost effectiveness of care are enabled by extending data reach beyond a single database of a single electronic health record application. A patient's clinical data may be stored in more than one electronic health record database in more than one location. A more useful analysis of patient health should include additional sources of decentralized data about this patient, the patient's environment, family history, and sources of accepted medical knowledge that might help the patient. More affordable gene scans allow a physician to analyze a patient's clinical data together with the patient's particular gene variants to better understand susceptibility to particular diseases and resistance to particular drugs. The ability to easily and quickly view all health factors for a patient will enable the physician to improve patient health more productively and more cost-effectively. Until now, all analysis has required that all of the data need to be moved to a central location for central processing. This is a time-consuming, expensive process, creating larger, disconnected data silos. The Zato Health Interoperability software enables decentralized analysis in parallel across diverse data sources. With a single user action, unified views or reports are returned to the user across existing networks. This more productive and efficient use of all available data will improve patient outcomes and greatly accelerate research breakthroughs. Zato Health has combined this decentralized analysis platform with an advanced and comprehensive suite of medical natural language processing, knowledge extraction, and automated coding software, as well as a comprehensive medical ontology. The demonstration you are about to see was recorded live, analyzing massive sets of diverse clinical and genomic variant data in parallel over multiple existing public and private networks, even though the data sources are located in different decentralized data centers of multiple organizations. This decentralized analysis can also include sources of general medical knowledge, like PubMed, in the same parallel analysis session.
The Zato Interoperability Platform is information fusion software for simultaneous analysis across diverse application data silos, wherever they are located, without the need to move and centralize all the data. The software provides an integration platform to connect applications and data across networks. Functionality includes search, combined structured and contextual analysis, knowledge extraction and association, data-driven navigation, knowledge discovery, reporting, continuous monitoring, and alerting. There are many use cases where the ability to federate across different kinds of data in different locations can aid clinicians and researchers in the medical community. We will run through 3 different use cases that demonstrate many of the capabilities of Zato, how it can support a query federated across many different locations, and facilitate the analysis of disparate kinds of data. The first 2 use cases address the question of genetic factors influencing individual differences in tamoxifen metabolism in breast cancer patients. In cases of estrogen receptor-positive breast cancer, tamoxifen has been shown to be effective in preventing recurrences of the disease. However, there are individual differences in the metabolism of tamoxifen, which are thought to be related to variations in certain genes on chromosome 22 and elsewhere. If we thoroughly understood the relationship between the genetic variants and tamoxifen metabolism, we could predict whether a particular patient would benefit from tamoxifen. A researcher could use Zato to find genetic data for people who have variant versions of specific genes of interest, querying many different sites in one query. For example, here we query genetic VCF data for cases that have variations on chromosome 22 at a certain range of locations. We are querying 4 different sites, each containing large amounts of data, 1 to 3 billion records at each site, with a total of 3.5 to 4.6 terabytes of data at each site. Here we query our 4 sites for variants on chromosome 22 at a specific range of locations. 6,347 hits are found. We can choose to group the results by collection and see that we found results from 2 different locations. We can also look at the documents from one location or the other. We could export the results into a file or pipe them into another application for further analysis. We can use facets to restrict the results to one person's data. And we can show the results in tabular form. We can see that all the results involve chromosome 22 because that's what we queried. Now we move on to use case 2. This is related to use case 1, but before we get the genetic data, we want to divide patients into groups according to clinical criteria. For example, what treatments they have received, or outcomes, and so on. Then we'll access genetic data for each group to find commonalities in the groups. Here we query clinical data to find patients that meet our research criteria. In this case, we are looking for a sample of patients who have estrogen receptor positive breast cancer, have received tamoxifen, and have had gene scans. We find 37 cases in this collection. We can look more closely at the clinical data returned to decide whether a patient is suitable for our study. This is one report from the patient's medical record. In the left column, we see the report text with highlighting for query terms. Next to that, the report has been analyzed to assign ICD-9 codes for signs, symptoms, and findings found in the report. Below that, lab procedures are listed, and below that, substances including drugs the patient is taking. If we want to get genetic data for that patient, we can select their ID from the facets and send a query to the genetic repositories that we queried in use case 1. We get a large amount of data back, but we know we are actually interested in variants on chromosome 22, so we can drill down just to variants found on this chromosome using the facets. Or we can narrow down even further to just the sections of chromosome 22 that we are interested in. Here we have narrowed down to just the sections of chromosome 22 that we're interested in for that patient. We can export these data or pipe them in to another application. We could also query for several patients genetic data at once. We can see from this result that we have gotten genetic data from 2 different locations. And we could use more of Zato's natural language processing analysis of the documents to find a subset of patients whose breast cancer has recurred, not improved. In the original query, we found 37 breast cancer patients on tamoxifen. Here, we find that 11 of them have had recurrences of their cancer. We now move on to use case 3, rare diseases. Worldwide, the definition of rare disease varies, but in the United States, a disease is considered rare if it affects fewer than 200,000 people, or 1 in 1,500. In Europe, it is estimated that 5,000 to 7,000 rare diseases exist, and that 6 to 8% of the European population is affected by one. Around 80% of rare diseases are known to have a genetic component. A practitioner may not have enough experience to know how best to deal with a rare disease, or perhaps the standard treatment did not work well, and they want to find other practitioners who have treated the disease in question. Or suppose a clinician encounters a patient with symptoms they have not seen before. They could query other practices for patients with a similar spectrum of symptoms. Practices could use Zato to de-identify clinical data and make the de-identified records available, so our puzzled clinician could get vital information without violating patient confidentiality. If they discover such a de-identified patient, they could then contact the patient's physicians to get more information. For example, suppose we have a patient with degeneration of ear cartilage. We could query clinical documents for other cases. Zato runs concept extractors, including a rare diseases concept extractor, on the results, and finds that the patient may have a disease called relapsing polychondritis, an autoimmune disease. This is a multisystemic condition characterized by inflammation and deterioration of cartilage. The annual incidence is around 3.5 new cases per year per million people, making it a rare disease. Here we see a clinical record found mentioning the symptom and the disease. Relapsing polychondritis is interesting from the point of view of research also. There is no evidence of a genetic predisposition to the disease, but there are cases where multiple members of the same family get diagnosed, suggesting that there is some genetic component. Zato can make it easier to find genetic data from different locations corresponding to patients with this diagnosis, so that the research can proceed to look for commonalities, as we showed in use case 2.
The normalized index data created at the edge by the Zato Health software remains securely in the same location where the source data are located and protected. These normalized indexes can be reused for a variety of reporting and alerting applications, such as the one that we just demonstrated for cross-clinical and genomic variant analysis, the DRG dashboard for proactive monitoring of diagnostic-related groups, patient quality measure reporting, reporting of meaningful use measures, clinical documentation improvement, risk stratifying patients, a variety of automated coding and billing, including ICD-10 and CPT, more effective and efficient search for patient records, automatically verifiable and linkable audits, and real-time tracking and quality alerts for more effective interventions. Unlike other healthcare applications, applications for the Zato Health Interoperability platform are crowdsourced and freely distributed to licensees of the Zato Health Interoperability platform. The most recent customer of the interoperability platform is a state university medical school, which is using the software to create a biobank registry to enable discovery of novel genetic variants associated with diseases or pharmacogenomic phenotypes. Zato's largest license is a statewide license enabling applications across state agency databases for Medicaid eligibility reporting, computing quality metrics across claims data and clinical data, and verifiable standardized quality measure reporting. Extending data reach for decentralized analysis will also enable nation-size research collections, including de-identified clinical data. To deploy the software more rapidly and ubiquitously, IBM and its resellers will deliver the software as an appliance on a P8 Power Linux server. Pilot deployments with this appliance are encouraged so that custom prospects can try before they buy. The IBM Zato is Power appliance can scale from a pilot to the most massive cloud deployments and hybrid cloud deployments affordably with high availability, efficient power consumption, cooling, and space utilization. For more information, please contact Zato Health using the contact information displayed on this screen.